Hi, welcome to this particular module. This is one of the most important aspect in cancer when it comes to selecting a particular therapy. Treating cancer is not very difficult in my opinion. Early diagnosis is more important, right, and that's where the novel devices that can early diagnose cancer becomes extremely important. But let us say if we diagnose a person suffering from cancer, what kind of treatment we can give so that we can save the person's life. Now traditionally we are what we are using chemotherapy, we all know, right, and in one of the module I have shown you how to design a device for rapid drug screening in case of chemotherapy. So, if you remember, it was a patient centric platform where you can take these cells from the patient, you can load in the device with Matrigel, you can flow different drugs, and depending on the efficacy of the drug we will be getting different electrical signatures, right, we have seen that. Having said that, chemotherapy is not so effective, this is what the statistics says, and it has lot of side effects. You may have observed a patient suffering from cancer, if given chemotherapy, goes to lot of side effects, one being losing lot of hairs, right, and what not, immune system goes down, the weight decreases, appetite is different, the person is agitated, right. So, what are the other techniques to treat cancer? Now there is a radiation therapy. Radiation therapy has been used after chemotherapy, and again there are lot of side effects. So, recently the research has been focused on developing immunotherapy, and we have in market few immunotherapy drugs. Now, as the name suggests, immunotherapy, that means a therapy that is related to your immune system, right. So, what is this therapy? Now, again as an engineer or as a scientist or as a researcher, whether you are clinician or you are a student, it is important to develop a patient centric platform. So, if there are 3 different immunotherapy drugs, which drug would be more effective for that particular patient? So, how can we do that, and where exactly this immunotherapy is used, right. So, today in this module or set of modules we will learn how to design a microfluidic chip that can be used to evaluate the efficacy of the immunotherapy drugs, performance of the immunotherapy drugs. So, let us see, let us understand what is immunotherapy, and let us see one aspect of how our device can potentially solve a very important clinical problem, that is bridging the clinician, not exactly clinician, but a patient and a drug, a system that bridges a patient and a drug and helps the clinician to determine which drug to give to a patient. Let us see. So, if you see the screen, we will be talking about, if you see the screen, we will be talking about a microfluidic chip for evaluating the efficacy of immunotherapy drugs, right. So, what we see on the screen, we will be talking about a patient centric in vitro platform for evaluating the efficacy of immunotherapy drugs. Now, if you see several cancers right now, so if you talk about stomach cancer is fifth most common and third most deadly cancer worldwide. Stomach cancer or gastric cancer is a core focus of immune based treatment clinical trials today. If we talk about lung cancer is the most common type of cancer worldwide, and immunotherapy is greatly improving treatment and prognosis for patients with lung cancer. If we talk about head and neck, right, oral cancer, head and neck is oral cancer is a part of head and neck cancer, is relatively uncommon, but serious cancer. Immunotherapies are showing significant promise with other approaches which have failed. So, immunotherapy is showing a promising result. When you talk about prostate cancer, it is one of the most commonly occurring cancer, particularly for white people. Immunotherapy is an exciting area of treatment for prostate cancer. Again, immunotherapy can be used for prostate cancer. Brain cancer, or you can say malignant brain tumors, are rare but very serious form of cancer. Again, immunotherapy is showing promising results. Breast cancer, like we know, is the second largest cause of death in women, cancer related death in women worldwide and also in India, and immunotherapy is used for treating cancer. Colorectal cancer, again one of the common type of cancer. Cervical cancer, typically caused by human HPV virus, and it is one of the major cancer types for which immunotherapy treatments are being developed. So, what exactly immunotherapy is? Immunotherapy is a type of cancer treatment that helps your immune system fight cancer, right. So, first thing that we need to understand is that it is a therapy that helps our immune system to fight cancer. The immune system helps your body fight infections and other diseases, and as we know, the immune system is made up of what? White blood cells and organs and tissues of lymph system. Immunotherapy has been recently used as a novel therapy approach to treat melanoma, lung, kidney, bladder and breast cancer. It is now widely accepted that effective immune response by infiltrating T cells, we will study about T cells, is limited by immunosuppressive environment present by the tumor. The overall survival of the patient with melanoma, breast, colorectal and lung cancer can be predicted by CD4 CD8 T cell ratio in tumor microenvironment and whole blood. Increase in CD8 T cells along with other immune cell subsets in presence of immunomodulator is an indicator of effective therapy. What does this sentence mean? Increase in CD8 T cells with other immune cell subsets in presence of an immunomodulator is an indicator for effective therapy. So, let us see. We all know blood, right? Just help you out. RBCs, red blood cells, white blood cells, plasma. This thing we know, correct? Blood, RBCs, white blood cells and plasma. Okay, good. Now, white blood cells. These are our immune cells. Immune cells helps for keeping our immune system intact. Now, there is something called thymus cells or T cells. T cells. Okay. T cells, if we divide it, there is CD4, CD8, Treg. CD4 is helper cells or CD4 cells are helper cells. CD8 cells are killer cells and Treg, as its name suggests, are regulatory cells. So, when a patient suffers from cancer, he is given a immunomodulator or immunotherapy drug and the concentration or the ratio of CD4 and CD8 is measured to see whether the immune system has been activated to kill cancer or not. So, CD8 level is higher compared to CD4 or not, or a comparative ratio. This can be found in the blood of the patient. CD4, CD8 can be found from the blood of the patient using flow cytometry analysis. It is also called FACS, flow cytometry analysis. Alright. So, now we at least know that okay, white blood cells, and then in that white blood cells we have T cells, in T cells we have CD4 cells, we have CD8 cells and we have T regulatory cells, right. So, what we will do with that? This is so how to take this T cells, right. T cells are thymus cells, they can be obtained from blood. Like I said, they can also, we can also get T cells from spleen, okay, spleen of the mice. So, this is a video where it is shown how the mice is operated, actually how we can take the spleen from the mice. So, that spleen, when you take it out, when you look at the video, first look at the video and see how the spleen is taken from the mice.
Okay, so for today's extraction, you're going to need 2 sets of forceps and a small pair of scissors. Sorry, is that too close? Okay. So first spray the mouse, or pin the mouse to the board, spray it down with 70% ethanol. and give it a nice little wipe. So this is so that the fur doesn't stick to your scissors as much. And then what we do is pull the skin up and make an incision at the bottom. And then you'll see this filmy layer here. What you want is the tip of your scissors to go through that. And then you're going to cut up. So you're cutting basically the layer of film and also through the skin. And you're going to cut all the way through the sternum. Okay. And so now you're going to make some incisions on the sides. And this is just to open it up to see what you're working with. And so it's not necessary, but you can pin this if you want to get a better look. Okay, so now you see the general area that we want to work with. So this is the liver here, this is the intestines. And so what you want to do is kind of move this all to the left, and so this exposes here the liver, here's the spleen in between, and then here is the kidney. And so it could be a little bit difficult to tell between the three, but the spleen should be in the middle, and it should be long and kind of solid as opposed to the liver, which is very squishy. Okay, so now you kind of take the spleen out, and you pull the fibers off. And you do this slowly so that the spleen doesn't rip. Because even though it's pretty firm, it can still rip. Okay, so now I've extracted the spleen, and I'm going to try to make sure that there's no remaining fat or fiber. Someone's calling us. Okay, and so now you can still see the kidneys here and the liver here, and so the spleen was right here. And now all you have to do is take that, put it into a 50 ml conical full of media. So this is complete media, and just drop it in. And that's it.
Okay. So as you have seen in the video, the spleen that is taken out from the mice or from the mouse will be placed in a RPMI 1640 media, and further to extract T cells from spleens, each spleen will be placed on a 40 micrometer cell strainer and crushed with a flat end of a syringe. Cells that pass will centrifuged and washed with PBS to obtain splenocytes. From spleen we get splenocytes. What does it mean? If we take this kind of tube and we have filter, right, which is our 40 micron cell strainer, and you put a spleen on this and you crush the spleen, with syringe, with a syringe you crush the spleen. This is spleen, right, there is a media here, and the cells will come out from the spleen. When you crush it, these cells would be nothing but your splenocytes. Okay. The spleen is obtained from the mice. Now, after you obtain splenocytes, what you will do? The native T cells, or sorry, naive T cells which are not activated, right, naive T cells will be isolated from these splenocytes using easy step mouse T cell enrichment kit from stem cell technologies, right. So, what we are doing, after we get splenocytes, we can extract T cells from these splenocytes with the help of easy sap mouse T cell enrichment kit. This is obtained from we can get it from stem cell technologies. Similarly, T cells from mouse PBMC will also be isolated. So, we can get T cells. Now, so from the spleen we have seen how we can extract T cells. We can also extract T cells from mouse PBMC. In that case, blood will be transferred to a vial with 9 ml distilled H2O and mixed by inverting a couple of times. This will kill the red blood cells. Immediately after mixing 1 ml of 10x HBSS or 10x PBS will be added. This will cancel the osmotic pressure of pure water and stop the lysis process, right. Cells will be spun down and supernunt discarded. PBMCs will be resuspended into the media. So, once you have T cells, then what you do? Once you have T cells, what you do? You have to activate these T cells. Why? Because in our immune systems the T cells are activated. So, you have to study lymph node, how lymph node helps in our immune system. So, in immune system these T cells are in activated condition, right, but what we get from cell from blood or from the spleen, we get naive T cells. So, once we get these T cells will be cultured. We have to culture these T cells in 96 well plate in immunocult media. This is a media specially for culturing the T cells and stimulated with dynabeads. So, dynabeads are used to activate T cells. So, that we have the activated T cells along according to manufacturer's protocol, and then we can study these activated T cells with either APC ret anti-mouse or FITC ret anti-mouse CD444 antibodies. So, do not get confused, right. This is a procedure to activate T cells. It is known by a cancer oncologist. It is extremely easy process if you follow the protocol, right. We are learning this so to understand what kind of device we are using and how it will be used to how it will be used in immunotherapy. So, that is why we are learning that what are T cells, what are T cell isolation kits, from where T cells we can obtain, what are the kind of T cells. When you understand T cells, we have seen CD4, we have seen CD8, we have seen T regulatory cells. Then what are naive cells? When we obtain the cells from the blood or from the spleen, it are naive cells, they are not activated. So, to activate it, because we are developing the in vitro platform, that is a platform that we are using in the laboratory, right. So, how can we activate those T cells, that is what we are learning. But the idea is not to really go down into depth of understanding how the T cell forms. No, we have to understand what kind of device I can use to understand immunotherapy, but to understand how we can design this device, we have to go through these steps, okay guys. So, do not get confused, it is very easy. So, if you see the screen, this is quickly I have taken a video of T cells. These are T cells flowing onto microfluidic chip, and you can see right, as the T cells are flowing. T cells are about 4 microns in size. Right. So, T cells, these are T cells, and like I said about 4 micron in size. Okay. So, what is the idea? The idea is that let us say a given patient, we take the cells from tumor and we grow spheroids, right, with the patient cells. We grow spheroids with the help of patient cells. These cells are extracted from the patient, right, from the tumor region. So, let us see how it looks like when you extract these cells which are cancer cells, right, and you want to grow a spheroid in the laboratory. Then you have to load these cells in ultra low attachment 96 well plates, okay. And this is example of B16F10 cells spheroid formation over 72 hours. First is 24 hours image, you can see it is 24 hours. In 24 hours it starts forming spheroid, it is not ready. At 48 hours you can see it is the cells are growing and developing in the 96 well plate. There is a media for providing nutrition. Finally, around 72 hours we can see a spheroid formed using B16F10 cells, right. We will be loading this spheroid in our device and learn the efficacy or evaluate the efficacy of our drug. That is why we are understanding how does a spheroid looks like when it is formed from the cells, how it is formed, how much time it is taken, right. So, about 72 hours we can get a spheroid. Now, let us see this diagram. It is very easy, very easy, do not get too much tensed, right. What we are interested is just immuno checkpoints. This is a cell, this whole thing from here to here, this is our cell, everything is cell, okay. And there are several checkpoints. So, what I mean by that? I will give you an example. Suppose you go on a so you can look at me if you can. So, I can show you a correct example. Okay. So, suppose I am driving a car, right, on a toll road, right, and I should have a pass that I can show it to the toll booth, that okay, this is my pass and let me allow to go through that toll booth, right. So, if I have this pass, then the toll booth guy will allow me to pass on the toll road, or if I get a ticket and I show that okay, I have paid, he will allow me to go past the toll road. If I do not have it, then what will happen? I have to pay fine, or I can be in jail for not following the rule, right. So, in case of our body, every cell has to show the pass to the T cells. So, whenever T cells comes to, let us say this is our cell, this is T cell, whenever T cell comes it checks, okay, show me your pass. If it shows the pass, it will go further and this cell can survive. if the cell does not have that pass, then this T cells will start prosecuting this cell and it will kill the cell. Okay. So, when you talk about this pass, these are the immuno checkpoints. Okay. Immuno checkpoints, you get example, right, you I hope you understood the example. Same thing like toll road, you take this example, it is very easy to remember. So, now what are these different passes or different immuno checkpoints that a cell can show to the T cell, that a cell can show to the T cell, right. So, if you see the screen, there are certain immuno checkpoints starting from OX40L, OX40L, then there is PDL1, there is CD80, right, to name few, CD80 or CD86, PDL1 or PDL2, right, there is a OX40L. So, when you have this immuno checkpoints, the T cells would have another checkpoint, so that it can see, right, it can talk, right. So, when we have PDL1, T cell would have PD1, if you have CD80, this will have CTLA4, if you have OX40L, T cell will have OX40, you see, that is how it can interact. So, if we are targeting one of the immune checkpoint, that is OX40L, then T cell would have OX40. If we are looking at PDL1, T cell would have PD1. If we are talking about CD80, T cell would have CTLA4. So, there are this lock and key mechanism available with T cell and the normal cell or cancer cells, with which they communicate and they understand where everything is going well with the cell or not. Okay. Now, what we are interested? We are interested, and in general the community, immunotherapy community is interested, one of the aspect is, if I stop this PDL1, if I block PDL1, the T cell cannot find PDL1. So, PD1 cannot interact with PDL1 and T cell may start killing the cancer cell. Or if I block PD1 on the cancer cell, then even there is PDL1 on my cell, which is my cancer cell, if I block PD1 on T cell, if I block PD1 on T cell, then since T cell cannot communicate with cancer cell, T cell may start killing the cancer cell, right, because it cannot talk, it cannot communicate, the immuno checkpoint is absent. That is of our interest. So, we will be learning a immunotherapy drug called anti-PD1. Anti-PD1. Anti-PD1 means it will block PD1 on T cell. So, if it blocks PD1 on T cell cannot interact with PDL1, right. What will happen to CD4? T cell is CD4, T cell is CD8, right. What will happen to CD4 and CD8 ratio? If I use anti-PD1, if I block PD1 on T cell, what will happen to CD4 CD8 ratio? So, we have to study this particular property using our device, Okay. Now, having said that, you see in vivo there is a dendritic cell CD28 and CDTCR, there is a resting T cell. When there is this kind of communication between dendritic cell and resting T cells gets activated. In vivo means within body. Okay. So, if we want to perform similar mechanism, we can use dynamids to activate these T cells. How? Dynamid will have anti CD28 and anti CD3. So, this will again cause the resting T cell, which is our naive cell, to activate. This is just a mechanism. Okay? That is the role of Dynamids. Okay. Now, let us come here. This image that you can see here is called transwell. Transwell, TRANSWELL. Okay. So, it is a well with pores which are less than 4 microns, less than 4 microns. Now, I told you the T cell size is about 4 microns. So, T cells cannot pass through this filter, through this well. T cells cannot pass through it. Okay. Now, what is the present study? Present study is using static platform. Static platform. Okay. In that, what is the mechanism? Melanoma spheroids, let us take an example of skin cancer. Okay. So, melanoma spheroids, which we have seen in the last slide, how the spheroid looks like, are placed into the matrigel, right. This red one is matrigel. Now, you load the T cells and see the interaction between T cells and matrigel. T cells, matrigel, and of course, your spheroids. This will interact, right, this will interact. So, our control would be T cells with matrigel containing spheroids, right. The spheroids are melanoma spheroids, This is our control. There is no treatment. After 48 hours, 24 to 48 hours, we will see CD4, CD8 ratio using flow cytometry analysis, Okay. Next step would be you treat this T cell. So, our experiment would be T cells treated with immunomodulator like anti-PD1 and placed on transwell in matrigel with melanoma spheroids. Again wait 48 hours or 24 hours and see the CD4 CD8 ratio. Now, when you treat T cells with anti-PD1, like I said, we are blocking anti-PD1 on T cells and we want to see what is the effect of blocking PD1 on CD4 CD8 ratio. This is a static way of performing the experiments and you will see a certain signature in CD4 CD8 because you are treating the T cells or with a immunotherapy drug and you are allowing the T cells to directly communicate with spheroids, right, in a static manner. The change in CD4 CD8 would be because of the release of chemokines as well. Okay. So, now my point is our body static? No. What is our body? Our body is dynamic. When we take a drug, this drug goes to a particular place and stays there? No, it flows with the help of blood, right? It mixes in the blood and flows to the blood. So, why to perform static experiments when our body is not static? That is the first question, right? That is the first question. So, we will see in the next module what we can do to create the dynamic platform, dynamic in vitro platform to perform similar tests that we have just discussed, and where exactly we are lacking. All right. So, understand immunotherapy once again, whatever we have discussed. I will see you in the next module, and we will discuss in detail what kind of experiments and what kind of device we can design that can evaluate the efficacy of a given immunotherapy drug, as well as it can act as a patient centric platform. Till then, you take care. I will see you in the next class. Bye.